How are you feeling? Okay, good. So this entire process is going to take about 2 hours, okay? The bulk of that, at least at first, is going to be just getting you hooked up. So really quickly, can I just have you verify for me your name and date of birth? Perfect, okay. Okay. So, do you have any history of seizures? Migraine? How about aneurysm? High or low blood pressure? Any history of asthma? Okay. And any allergies to adhesive? Right. Alright. So I'm going to be getting you hooked up, okay? And that part's going to be a little bit lengthy. The good news is that our electrodes are now wireless, so you're not going to be having a whole lot of wires and stuff hanging off you. But the downside of that is that we do need to make sure that they are really stuck to you, so it does make this part go a little bit longer. We have to go through and apply some alcohol to your scalp where we're going to be sticking the electrode, so that way we make sure they have a really good connection. Do you have any kind of product in your hair, like gel, hairspray? Okay, good. That should help this process quite a bit. So to start, I'm going to be measuring and making some marks with a little makeup pencil. So the first one just goes right here, right in the middle. I'm going to turn your head just a little bit, okay? So. going to be sticking these electrodes on now, and while we're doing that, I'm also going to be having to clean the areas they're going to stick to with some alcohol. Do the first one. Let's make sure we have a signal. Okay. So one thing is, because I am currently cleaning the oils off of your scalp, it does mean that the conductive gel that helps adhere these to your scalp is going to have a harder time being removed. So what we recommend is, instead of trying to pick it out, we recommend that patients kind of soak their heads in some warm water. So like when you get home, take a bath. And then you're going to want to use a little extra conditioner than what you'd usually use. And it should melt and come right out at that point. But if you have trouble, just repeat the process. usually it only takes one. But especially for people who have particularly sensitive scalps, then we want to let them know to maybe try it a couple times. Alright, and I've got two more that are just going to go on your chest. So we can record your cardiac activity. Okay. Alright, looks like we got a good signal here. Okay, so I want you to remember for me two words, okay? And they are green apple. So stare right here, right between my eyebrows, alright? Good. Okay. And now don't turn your head. Just keep your head very still. And I want you to follow my light just using your eyes. Good. Okay. Tell me when you see my light enter your field of vision. Good. And again. Good. Okay. And what were the words I asked you to remember? Perfect. Okay. Can I have you close your eyes for me? and open. Good. Close. And open again. There are cameras actually that are recording you, which is how I could tell. Okay, so now I want you to remember the words red wagon, okay? So I'm going to place this tissue over your eyes, and you're going to see a flashing light. It's not going to be very quick. It is normal if you start seeing some different patterns or colors, okay? Don't be alarmed if that happens. So, just like that, okay? Now you're going to see the light pass over your eyes. Okay. So can you tell me what the two words I asked you to remember this time? Perfect, okay. Okay. So now we're going to do some breathing exercises, and this might seem a little strange, but the point of this is that with different changes in breathing, it can bring out some seizure activity. If that were to occur, then don't worry, we have the means to take care of you right away. But we need to see if anything can be triggered. So I'm going to have you take some short inhales with a longer exhale, and you're going to do that 10 times. So that what that looks like is you're going to inhale for a count of 2 and then exhale for a count of 4. So inhale and exhale. Okay, so let's have you continue to do that. Good. Doing great, keep going. And while you're doing that, I want you to remember blue dog, You're almost there. Okay, last one. Great. And what were the 2 words I asked you to remember? Perfect, okay. Okay. So now I want you to remember yellow kite, okay? I want you to tell me when you feel my applicator here make contact. Good. 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 And what were the 2 words? Perfect. All right. Now one more, which is pink heart, okay? So I want you to do your best to focus right here. It's going to look like I'm going to poke you in the eye, and I promise you I'm not going to. I'm just testing your blink reflex. So, good. Just like that. Okay. Good. Good. What were the words I asked you to remember? Excuse me, my tongue is rumbling. Okay. Okay. So now I'm going to be stepping out of here, okay? And I want you to close your eyes and kind of take a little nap. We have camera here, there, and there that are going to be recording you and also letting me keep an eye on you to make sure that everything's okay. If at any point you need anything, just wave, okay? and I will see it and I will come in immediately. Do you have any questions before I step out? Okay, so let me just make sure everything is looking good. Nice connection for all of her electrodes. Okay. Are you warm enough? Okay. If that changes, just wave and I can bring in a blanket. Okay? Okay. Have a nice nap.